project, some anticipated outcomes, and conclusion. This is a 5-year project, as I said, and the project itself was developed in collaboration with International Center for Social Development at Tulane University, as well as National University of Rwanda School of Public Health, and the National University of Rwanda School of Social Work. One of the issues in Rwanda is they had a lot of treatments that were available to the country itself, but people were not taking advantage of the treatments. Adherence was a major issue. And the School of Public Health, as well as the medical school in Rwanda, had these very well-trained clinicians who were working out in the clinics throughout the country, but they couldn't understand why no one would come in for treatment or would continue to receive treatment once they went in once or twice. So they started consulting with the School of Public Health and the School of Social Work at the National University of Rwanda to try to determine what can be done to get people to adhere. As a result of those discussions and as a result of the interest of the International Payson Center for Social Development to help with this challenge in Rwanda, they came to the School of Social Work at Tulane and asked if we could help them to develop a curriculum using a trainer model for the psychosocial care people living with HIV and AIDS. And from now on, when I say people living with HIV and AIDS, that also means children and youth living with HIV and AIDS. They wanted us to develop a curriculum delivered in a trainer model in order to expand not only social work capacities in Rwanda, but also capacities of provider organizations in meeting the psychosocial care needs of people living with, specifically to help improve treatment adherence. So some of the goals of the project, particularly in working with the National University of Rwanda School of Social Work program, was to have participants gain basic and in some cases advanced knowledge and skills on providing psychosocial care for people living with HIV and AIDS, user training or trainer model to promote treatment adherence, expand and build capacities of the provider organizations in meeting the psychosocial needs of people living with HIV and AIDS, and expand social work capacities for the National University of Rwanda. So in developing the course, we came up with 3 key modules. And as a result of those 3 key modules and implementing the modules in year 1, we discovered that we needed to have a pre-module course as well, and so we developed that at the end of year 1, and now the individuals who are participating in cohort number 2 have access to not only the 3 key modules, but also a pre-course training module. The pre-course training module we learned in delivering the modules to the first cohort is they needed more background information on general HIV knowledge and concepts, as well as Rwanda-specific knowledge and data. One of the reasons why that became necessary is the individuals who participate in the training project run the gamut in terms of knowledge and skills as relates to HIV and AIDS, as well as basic social work concepts. And so we had to implement something that would sort of get everybody on the same page in terms of their HIV knowledge, as well as HIV knowledge in the Rwanda context. Module 2 specifically looks at social work concepts, theories, and skills, as well as social work in the Rwanda context. And again, that is at the request of the National University of Rwanda and looking to expand their social work capacities. Module 2 specifically, we targeted the intervention approach of case management, which is a growing intervention approach in Rwanda, but they had very few people who had knowledge and skills to be able to implement case management within the various HIV provider organizations and or agencies. And they also wanted to look at specific issues, psychosocial issues impacting treatment adherence. So stigma and discrimination, cultural barriers, gender-based issues, nutrition, lack of access in the various communities, transportation, all these kinds of things are major barriers in supporting treatment adherence. And so we, part of the module focuses on some of those activities. Module 3 looks at co-occurring disorders, including substance abuse and mental health, and other issues specific to the psychosocial needs of people living with HIV and AIDS, including care services for caregivers of people living with HIV and AIDS, grief and loss, and then population-specific issues. Some of the activities of the modules that we developed as part of the curriculum. This is a competency-based mastery learning module or model that we use. And some of the activities include lectures where there are lots of PowerPoints, experiential learning with role play and engagement and interviewing skills. And those activities were videotaped throughout the various modules. case vignettes, and there were lots of case vignettes that range from very, very simple to the more complex, depending on the situation. Class presentations, which were either individual or small group, field visits. In each module, participants actually went out to a provider organization and got a sense of what it was like to provide services in the context of that organization. Many of them focused solely on what they were doing in their own organizations with very little knowledge about what happens in the other provider agencies. So we would take field visits at the end of each module to give them a sense, a broader sense of how HIV delivery or HIV services delivery are happening throughout the country. Some of the other key activities included take-home assignments, transitional assignments, so in between each module there would be a transitional assignment that students would have to complete and submit to the professor before they began module 2. We had teach-back exercises where students would take a chunk of the content that they learned as one of the modules and present that back as if they were presenting either an in-service training workshop, a brief workshop, or a full training or trainer workshop. We also had students to develop population-specific training manuals. So some of the individuals were working in advocacy organizations, some were working in hospitals, some were working in mental health care settings, some were working in schools. So the needs of each of those environments in terms of their knowledge about providing psychosocial care for people living with HIV and AIDS, we wanted them to contextualize their manuals so that when they did their trainings in the various communities, they would be targeting specific groups. So if it was nurses, that would be basic content that would be part of their training, but then there would also be nursing-specific information and case vignettes that nurses would likely encounter. We recently developed pre-post test knowledge and skills assessments for our training participants, and we had to modify the curriculum sort of throughout. We originally developed the curriculum, but due to some cultural issues, due to translation issues, and also just due to the needs of the participants, we either had to modify it to make it less complicated in terms of the presentation of the content or ramp it up and make it more complex because some of our participants had advanced knowledge and skills in psychosocial care as well as social work. So our graduates, once they graduated, part of their responsibility was to do some of the following. Delivery of the trainings themselves, either in in-service trainings in their organizations, brief workshops in the community that would be 1 to 2 day workshops, or full training of training workshops, which could be 5 to 7 days. They had to assist me, and I'm the primary faculty person for the certificate program. They had to assist with technical assistance if they were doing a full training of trainer workshop, assist with monitoring and evaluation activities. We just started this idea of co-facilitation with the faculty person, so we identified 3 individuals who were exceptional in their participation in the course and completion of the various assignments and activities, and who had educational credentials. They are now co-facilitating the different modules along with me. And part of that was, originally we started out with 3 faculty persons from the School of Social Work at Tulane. Well, 2 of them dropped out, and that just left me and all of the work that's a part of it. So I had to bring in some help. So what better way to get that help than to use the qualified trainers and help with facilitation as well as some of the other activities, including assisting with the development of additional modules. And we're sort of in process and thinking about what additional modules may be needed to further advance what's already been taught. Technology. As we completed year 1 of the project, one of the major challenges was when the participants got ready to go out and deliver their actual training or training workshops, they had their training manuals, but a lot of the information they forgot, or they didn't deliver it in the right way, or didn't deliver the right information. And they didn't want to rely on the training manual so much and sort of using it as a reference to help them determine what's appropriate in delivering the content for their training of trainer workshop. So the idea was presented that why don't you guys create a DVD that all of the participants can access. And the participants, most of them have internet access, most of them have laptop computers, so the use of a DVD would be fairly easy for them. And we put all of the training content, including each of the modules, as well as the exercises, the case vignettes, the videotaping of the different exercises that were done in class, the videotaping of the teach-back exercises, all of the forms that they would need for their training or training workshop. We put all of that information in one place on a DVD. So anytime they got ready to do a training or trainer workshop, they would be able to take that DVD, pull it up, they could pull out information from the DVD and put it in one presentation, or they could use all of the information in Module 1, a little bit of the information in Module 1, some of the information in Module 2, maybe a little in Module 3. So they decided, outside of some key elements that they had used in their training or trainer workshop, what they would pull from the DVD in their presentation. Also, the DVD allowed the provider organizations that sent participants for the certificate program to have use of this information in any way they needed to. So the participant would take that DVD back to their organizations, and the organizations then would be able to pull out the information from the DVD and helping them to deliver appropriate psychosocial care and supportive services for people living with HIV and AIDS. One of the additions that we've added along with the DVD is we're now making the course available in EXE, which is an online package that can be used for participants in the course only or the administrators in their various organizations. So they'll be able to access all of the content online. And one of the things that we really need this process for is being able to upload the monitoring and evaluation forms that students have been really slack in getting that information to me. So we're hoping that it'll make it easier for them if they know they can go online and just put in the information that they need, and they don't have to worry about trying to email me forms or having some challenges with technology and getting the information to me. This is a heuristic of what the process looks like. So it sort of starts out with the social work faculty and the university collaborations that we have along with the local agency partners. Then the development of the curriculum, identification of appropriate participants, piloting of the program, the delivery of the modules, graduation of the participants, and as a result in what we've learned in delivering of the modules, developing the DVD, piloting the DVD, and then field testing the training of trainer workshops. And we've now evolved to having it available online, hopefully by fall 2010. Some of the anticipated outcomes: trainers able to access training content from multiple sources, so not only will they have the DVD, they'll have the training manual, and they'll also be able to access it online in their various organizations. Videos are used as exemplars, so for instance, if people are trying to teach a particular interviewing skill, they'll be able to pull up an exercise that shows a demonstration of that particular skill in their training or trainer workshop. They can also use this in their organizations. Even in assessments, they can do that. Improve capacity and self-efficacy of trainers in delivering key content of the training modules, and improve organization access in the training module content. In conclusion, there's substantial evidence to suggest the effectiveness of a training or trainer model. This seems to be the most appropriate model in trying to not only meet the social work capacity needs of the National University of Rwanda and the School of Public Health in Rwanda, but also the delivery of services that focus on HIV care and support for people living with HIV and AIDS. We also have very little information about the use of technology in a training or trainer model. In reviewing the literature, I was not able to find very much information about the use of technology in a training or trainer model other than using it as distance education. Our goal was not to create a distance education course. In this particular case, we just wanted to make the most use of technology and helping students to be able to deliver the content in a training or trainer framework. So some of the goals of using technology of this project is to demonstrate the effectiveness of technology in a project like this, using a training or trainer framework, improve facilitation skills of the participants because they actually get to see themselves delivering not only a teach-back exercise but also a training or trainer mini workshop, and improve capacities of the service providers in meeting the needs of people with HIV and AIDS. Any questions about the project? The handout that I have is a paper that I'm co-writing with one of the graduates of the course. He's going to be pursuing his PhD, and I will say in Rwanda, right now, and they haven't had for a long time MSWs. They had one MSW 2 years ago. He's now working on his PhD, so they have no MSWs in Rwanda. So this course is really designed not only to help encourage those who are getting an undergraduate degree in Rwanda in social work to stay in Rwanda, but also now CDC and USAID is ready to help support Rwanda in establishing their own national social work program in order to keep the undergraduates of social work in Rwanda to get their master's social work.
Okay, thank you, Sonia.